morning, everyone. My name is Diaja.
Good morning, my name is Ariel, and today we will be doing a patient education video on implants. My name is Ariel, and I heard you were interested in wanting to know more about dental implants.
Yes, I've heard about them, but I'm not really sure what they are. Can you explain?
Of course. So a dental implant is a small titanium post that is placed into the jawbone. It acts like a root of a missing tooth. After it heals, we attach a small connector piece, which is called an abutment. And last, a custom crown is placed on top of that abutment that looks and feels like a natural tooth.
Will it hurt?
Most patients say the procedure feels easier than getting a tooth extracted. But don't worry, you'll be numb very well during the placement. And after the numbing wears off, you may feel some slight discomfort, but it can be managed with over-the-counter medication.
Okay, and how long does this process normally take?
It generally takes anywhere from about 3 to 6 months. That's because the implant needs time to heal and to connect with your bone. This is called osseointegration. And once that's complete, we place that abutment and then the final crown.
Will it look natural?
Oh yes, absolutely. The crown is custom made, custom designed to fit your color, shape, and size of your surrounding teeth. You won't even be able to tell if it's a natural tooth or not.
Good morning, Ms. Jones. I heard that you came back in so that we can finish our conversation on dental implants.
Yes, good morning. I just have a few more questions that I just needed clarity on. So my first question is, will I need a bone graft?
Possibly. If you've been missing a tooth for a while, the bone may have shrunk. So we'll go ahead and take an x-ray to determine whether you have enough. If needed, we can insert a small graft so that it can further strengthen the implant.
Okay. And how do I take care of an implant?
Just as you would with a normal tooth, you will brush twice, floss daily, and keep up with your cleanings. Dental implants have been known to have a lot of plaque buildup, so we want to be careful with that.
Okay. And how long does an implant last?
With good care, it can last many decades. Normally, the crown would have to be replaced due to normal wear, but the implant itself is designed for a long-term solution.
Okay, that makes sense. So what would actually be the next steps?
So first, we'll start with a full exam and dental imaging to make sure that an implant is the right fit for you. Then we'll start with plan the placement, and then we'll walk you through the whole process.
Okay, sounds good. I'm excited.
Thank you so much for coming in.
You're welcome.